So we analyzed, so this is the data from the Quicker registry, which is a quality improvement initiative of registry data, which we collect for all patients who receive thrombolysis as well as endovascular treatment within Alberta. The current analysis that I'll be presenting on is restricted to southern Alberta, so Calgary and the area around. Yeah, so we collected data for patients who underwent endovascular treatment between January 2015 to December 2020. And imaging data was reread by physicians with the two physician consensus. And we included patients who had undergone medium vessel occlusion, which was defined as occlusion beyond M2 MCA, A2 AC, and P2 PCA. And these were compared with large vessel occlusion patients. So because this is registry linked data, which we further linked with administrative data. So the study actually has a pragmatic administrative outcome, which is 90-day home time. Now 90-day home time is basically the number of nights a patient is back to their pre-morbid living situation without increasing the level of care within 90 days of stroke. So unlike conventional trials or conventional studies which use MRS as an outcome measure, we've used 90-day home time here. And one drawback of 90-day home time is it has a very skewed distribution, so with an inflated zero. So we had to do some random forest regression modeling to account for that. So in the end, we had our 806 cases in the registry, out of which 139 were MeVO and 524 were non-MeVO or LVO cases, and we compared the two groups. So on baseline characteristics, we really did not find anything. Surprisingly, we didn't find anything different, except that the large vessel occlusion patients were slightly older as compared to those with medium vessel occlusion. And the large vessel occlusion patients with large vessel occlusion had higher percentage of poor collateral score as compared to the medium vessel occlusion. But otherwise, their baseline characteristics were pretty much similar. And we also in our results did not find that home time was significantly different between the two groups. So on further doing random forest regression, we found that there was not much difference between the home time in patients with MeVO as compared to LVO after adjusting for all other covariates. And but having said that, there are certain limitations to the study because this is non-randomized data. We've collected it from a provincial registry, and the primary outcome of 90-day home time, although it has been validated against MRS in multiple studies, it is not something that is routinely collected in clinical trials. So direct comparison with other data is difficult. Only patients who underwent EVT were included in the study, so we don't really know what happened to the MeVO patients who actually did not undergo EVT as a comparator. And overall, the numbers are small. There are a lot of ongoing large randomized studies which will help us answer this question better.